Well, hello, welcome to Thursday's live webinar on Medicare. Today, we're going to take a look at the Medicare Advantage versus the Medicare Supplement. Let me make sure my pen is working here. All right. My name is John. I'm president of Riley and Associates. We are a local independent insurance agency. We specialize exclusively in Medicare. Today, we're going to cover the basics of Medicare. We're going to take it through kind of a roadmap here. So the basics of Medicare, kind of high level today. Every other Thursday, we go take a deep dive and really get into the details, enrollment periods, and all that good stuff. But today, we're just going to keep it very high level. We're going to take a look at the two paths, your two options for covering the out-of-pocket costs from original Medicare. And those look like what's called the Advantage Plan, which works much like an HMO. And then the Supplemental Plan is your second option, which works more like a PPO. You know, it's not a lot different than what you have now. You either have a PPO or an HMO now, but the big difference is when you go to Medicare, the benefits just get a lot better. And then we're also going to take a look at, kind of how to choose what's the factors involved in making a decision between, do I go with, original Medicare and a supplemental in Part D, or do I go with the option 2, which would be like an Advantage HMO Part C plan. So we'll take a look at that and then kind of clear next steps. So here's the basics of Medicare, very basic, right? So health insurance, Medicare's health insurance provided by the federal government for those age 65 and older, and for those that are under 65 with certain disabilities. And what you should know, which most people know, Medicare does not cover everything. So you've got out-of-pocket costs. That's why we're going to look at some different options and how Medicare works, okay? So there's 4 parts to Medicare. Part A and Part B is known as original Medicare. Everyone needs to get original Medicare. So either you're going to sign up prior to turning 65, usually about 3 months, 2 to 3 months prior. You should have a discovery call and then sign up. And then, when you're getting ready to retire, you're going to sign up for Part A and Part B, or Part B only if you already got Part A. If you have questions on that stuff, call me. Okay, but we're just going to keep it high level. So original Medicare, and then you're going to sign up online, whether you do it prior to your birthday or when you're coming up to retire. And the only time you're not going to sign up is that if you actually are receiving Medicare benefits, income benefits prior to turning 65, then Social Security will enroll you ahead of time, 3 months ahead of time, and you'll get your card, your original Medicare card, usually a few weeks before the effective date of Part B. Okay, but for today, we're going to go into the 4 parts. So Part A is your hospital insurance. There's generally no premium for that. That covers inpatient stays and skilled nursing. Part B is your medical insurance. There's usually a premium with this. It starts off at $292 for 2026, but your Part B covers your doctor visits, labs, x-rays, diagnostics, things like that. So Part A and Part B is known as original Medicare. You generally just have one premium for Part B. If you are in a higher income bracket, then you're going to pay a higher premium, which we'll discuss a little bit more here in detail, but it's called an IRMA chart, income related monthly adjustment amount. And if you do trigger a Part B premium, so you're paying a higher premium than the standard, you're also going to pay a little bit higher Part D premium to Social Security as well. Okay, so if you stay with original Medicare, Part A and Part B, you're going to add a supplemental plan, which we'll look at here in a second, and Part D, because original Medicare does not come with prescription drug coverage. And even if you don't take drugs or medications, then you need to add a prescription drug plan. It's required by Medicare. Otherwise, you'll end up getting a penalty, and you don't want to do that. Okay, so that's your one option. Option two, which we'll look at, is an alternative way to receive Part A, Part B, and Part D, which is called an Advantage plan under Part C of Medicare, and that works just like an HMO plan. So this one works more like a PPO, and Advantage works more like an HMO. Okay. So if you stay with original Medicare Part A and Part B and you do nothing else, this is the way it works. You're going to go see a provider, you'll give them your Medicare card, and then they're going to go ahead and bill Medicare for the services they provide. And then Medicare is going to pay them for those services, and then they're going to bill you the balance. So there's deductibles, co-pays, co-insurance, and no out-of-pocket maximum with original Medicare. That's why you're going to either add a supplemental in Part D, or you're going to go with an Advantage plan to cover those out-of-pocket expenses. And what we'll do with either option is we're going to trade out you for the insurance company, so they will pick up the balance of these costs. And we'll take a look at those here in a second, really. Okay, so here's kind of a high level look at both paths. So option one is you stay with original Medicare, you add you add a supplemental plan to cover the gaps, that covers the deductible, your co-insurance and out-of-pocket expense, and you add a prescription drug plan because that's not included with original Medicare. So option one is going to work more like a PPO. It gives you the ability to see most any doctor, any hospital throughout the nation with not a lot of rules. The insurance company doesn't get involved. If Medicare pays, the insurance pays. And so that's going to be your option one. Option two works more like an HMO. It's called an Advantage plan under Part C, and they're going to cover Part A, Part B, and Part D, which is included, and you're going to get some extra benefits as well. So both really good options. You're going to be familiar with one of the two options very well because you're either on a PPO now or you're on an HMO now. And HMO does require, a primary care physician and a small network. Your PPO plan or original Medicare does not. On a PPO, you do have a network, but it's usually a much larger network throughout the nation. And but here with original Medicare, you do not have a network, so it's an added bonus as well. Okay. So let's look now. If you have Medicare Part A and Part B, you've got two paths to cover those out-of-pocket costs, which is what we're looking at today. So one is either going to be, you're going to add a supplemental plan to Part A and Part B to cover those out-of-pocket costs, or you're going to go with an Advantage plan, an HMO model, and that's going to cover Part A, Part B, and those out-of-pocket costs. Okay, so both have really low out-of-pocket costs, so reducing any kind of financial uncertainty. So that's the nice thing when you go to Medicare, again, is that you're going to have very low out-of-pocket costs. This here on the supplemental is very predictable. You're going to have a higher monthly premium because basically you're paying for the ability to, go to the doctors and hospitals you want in the states that you want and that sort of thing. So you're going to pay a higher monthly premium and but very low out of pocket. You generally just have a Part B deductible of $283 for 2026 plus your copays for medications. So here you're going to pay a high monthly premium, very low out-of-pocket cost, and you've got the freedom to go to any doctor, any hospital throughout the nation without your insurance getting involved. So no prior authorizations or any of those rules that you're going to see sometimes with the Advantage plans. So the Advantage plans here, that works more like an HMO. So you're going to experience here in California, generally most of the plans are a zero premium. There are some with premiums, but very few. They have zero premium and very little copays as you use the plan. Again, very strong, you don't have much in the way of out-of-pocket costs, just like your supplemental. They're just two different model designs. It just depends on what you're most comfortable with. So with an HMO, you might have some copays here in these areas, but most of them are zero here in California still. You do have a network, right? You've got your primary care physician, just like your regular HMO, and you're part of a medical group connected to a local community hospital. But again, here in California, I always say we've got one of the best networks available. You've got, Cedars, UCLA, PIH, Torrance Memorial, Providence. I mean, the list goes on. It's just a tremendous network here. And that includes your drug plan. So your drug plan is built in, just like what you're used to. And then your annual out-of-pocket cost is very low on your HMOs. Both plans offer very low out-of-pocket costs. The supplemental on the health side is generally just your Part B deductible, so under $300. And then your Advantage plans usually run about $300 to $500, but all are under $1,000. But most of them you're going to find around, $300 for your out-of-pocket maximum. But again, it's going to be hard. You're going to have a hard time ever getting to that number just because you have low copays. Generally, with your Advantage HMOs, the area you're going to see a copay is usually going to be for ER. You're generally going to have a copay, and the ambulance, you'll always have a copay. So those two could get you to that $300 or $500 out of pocket, but generally very low cost. So here they are again. So as we discussed, these are your two main paths. What's important to understand is kind of, how they're structured, right? So with, the supplemental or Advantage plan, or supplemental plan, excuse me, with original Medicare, you have a high monthly premium or a higher monthly premium, but very low cost as you use the plan, and there's no network. Here you do have a network, right? You've got a primary care physician and in a local community hospital that you're going to use. However, you're going to have a zero to very low monthly premium. You'll still have very low low copays and costs as you use the plan. But this is going to have a network, so you have to get prior authorizations in some cases or referrals. Both excellent options. Both very low in the way of out-of-pocket costs. And it just really depends on, kind of on your budget, what you're used to, your lifestyle, that sort of thing. Those are going to be some of the factors, but just kind of a quick comparison. An Advantage plan, again, is an HMO. It's going to cover your Part A, Part B, and your prescription drug. You have a low monthly premium, usually zero here in California. Your supplemental, you're going to have a higher monthly premium. You have a very low out-of-pocket cost for both plans, very minimal. You've got, for an Advantage plan, you do have a network. Here, you've got a nationwide access. So you have no network, which is nice. That's why you're paying a higher premium here. And no referrals required. Your insurance doesn't get involved. So there's no network, no insurance involved. If Medicare pays, then the insurance has to pay. And the drug plan is included with the Advantage HMO, but you have to get a separate one here if you go with the supplemental. If you don't take medications, you still have to get a Part D, but just let us know, we can find that out on Discovery Call. But there's plans that have zero premiums, so you can still get that. But you don't want to just assume that, hey, I don't take medication, so I don't need Part D. You do. It's required by Medicare. You're going to pay a penalty if you don't. So you definitely set up a Discovery Call. We can go over all of this stuff and make sure that you're set up correctly. Okay, but both really good options. Just depends on your lifestyle. So, the key factors, again, is what's your monthly budget, your health status, doctors and referral preferences, lifestyle, risk tolerance, that sort of thing. Just different way to look at it here is for an Advantage plan, if you're healthy, you don't use your plan much, you don't have much in the way of requirements, an Advantage plan might work really well for you. You like your local doctors and networks and that sort of thing. That would be a good option. The other option is a supplemental plan. Again, it gives you a lot of freedom here. You can go where you want and do what you want. And, if you've got some conditions you're working on, this might be helpful just because you're not in a network. You can go, across country to go see a specialist or something. But both, again, are really good options. It just depends on what you're used to, what your health is, and we can talk about that on the discovery call. Common mistakes is people will choose a plan based on benefits or based on cost, and it's really kind of a longer term look. So you need to really, do some discovery there and determine, from a healthcare standpoint, what are my healthcare needs? What's my lifestyle looking at? What's my budget look like? And, there's some variances between those two plans in terms of, being able to automatically enroll in both plans. So there's some rules there that you'd need to discuss as well. So the right choice, just kind of review your personal situation, compare both plans side by side, get guidance from someone like us as a specialist. We do everything in three parts. We set up a discovery call, find out what your needs are. Then we put together a presentation based on your needs. We go through the basics of Medicare so you understand that. Then we go through your options, both on the HMO and PPO based on your medications, healthcare needs, doctors, things like that, so you can make a good decision. So that's how we work with you. And then we also help you with the annual enrollment period, reviewing things for you every year because your health does change, right? So as we wrap up, here's kind of what you want to remember is typically with an Advantage plan, you've got, very low monthly costs. You kind of pay as you go, but again, very low out-of-pocket costs, and it's network based. Works like an HMO. The supplemental goes with original Medicare, fills in those gaps, pays for the deductible and out-of-pocket costs. Your only real cost is you've got a monthly premium there that you're paying, plus a Part B deductible of $283, at least here in 2026. That's going to adjust a little bit every year, but that's just your main cost as you use Part B. And once you pay through that once, you're done for the year. Again, it's not one size fits all. It really depends on your past experience, your health, lifestyle, budget, and we can go over all of that. So if you do want to take a deeper dive on Medicare itself and your enrollment periods and a lot of those things, important things that we didn't cover today, what's guaranteed issue and how does that work, all of that stuff, we go into a deeper dive every other Thursday in Medicare Basics, and it's a little bit longer presentation. Okay. But anyway, hey, thanks so much for joining us today. If you'd like more information, we can set up a discovery call. There's no cost to you. We cover most of your plans and carriers here in California. So we can review all of that stuff with you. And you can go to MedicareSouthBay.com. That's our webpage. And you can, there's some videos and documents. You can also schedule a call there as well. Our phone number, you can call us, you can email me directly. But anyway, hey, thanks again so much for joining us today. Hope you found this helpful. And again, this was high level, so we can get into the details if you want to set up a call with us. Okay, all right, or you can join us next Thursday. All right, thanks. Take care.